Stress has the ability to significantly damage one's health. It can damage various aspects of your health, worsen certain illnesses, and even play a role as a causative factor for certain illnesses as well. Let's talk about how that actually happens. So stress causes the stimulation of what is known as the HPA axis. This is the hypothalamic pituitary adrenal axis, and this causes the release of a hormone known as cortisol. Now, generally, cortisol is considered an anti-inflammatory hormone. However, in the case of chronic stress, certain changes occur within our immune function that actually leads to an increase in inflammation. Along with this, it also releases catecholamines such as epinephrine, which results in increased blood pressure as well as increased viscosity, which is the thickness of the blood. In addition to that, other hormonal changes occur that actually leads to the accumulation of visceral fat in the belly. This is the most dangerous type of fat in our bodies. This is the fat that actually accumulates around our internal organs. In addition to that, it also leads to the release of a hormone known as glucagon. This causes an increase in blood sugar. Now, an environment where there's increased inflammation, increased blood pressure, increased blood sugar, blood viscosity, and weight, this is the perfect breeding ground for disease. If you look at the link between blood sugar and disease, you're going to find that almost every other chronic disorder is linked to what is known as insulin resistance. Stress has the ability to make this worse. Insulin resistance is where your cells don't interact with insulin very well, and your blood sugar starts to increase because insulin is what opens up your cells and allows sugar to get into it and out of the blood. So stress has the ability to make this function less efficient. Now, when you combine all of this together, it basically puts you at risk for developing what is known as metabolic syndrome, which is a precursor to metabolic diseases such as heart disease, strokes as well, and diabetes, as well as much more. If you look into the various things that are related to blood sugar, such as dementia. For example, if you Google diabetes type 3, you'll find that there's certain physicians out there that are considering labeling dementia, Alzheimer's dementia, as diabetes type 3. And that's because blood sugar plays a role in this, a huge role, specifically insulin resistance in the brain. Now, stress has the ability to worsen all of these things. We find that in autoimmune conditions, stress can actually make them worse. Stress has the ability to actually trigger the onset of some of these illnesses as well. So stress is something you definitely want to get under control. Now, I will be discussing in further videos what can actually be done about this if you already have an illness or if you're at risk for developing one, because there's a lot of solutions.